I'd like to start out my presentation by asking you in the audience a question. And it's a little challenging for me right now because I can't actually see you. But I want to ask you, how did you learn relationship skills? If you have any thoughts about that, then just put it up in the chat. How did you learn relationship skills? By accident, from my parents, trial and error. Yeah, so that's actually the way most people learn about relationship skills, either from their own life experiences, also known as trial and error. Having relationships, making mistakes, hopefully learning from those mistakes. Another common way that was mentioned is observing others, like parents, family members, other role models. Another common one is media, like what people do in the medias, in the movies or TV, books and articles. But there are some people, and notice that you can learn either healthy or unhealthy relationship skills from each of these ways. But there are people out there who never learn healthy relationship skills on their own. That doesn't mean that they're bad people. It doesn't mean that there's anything wrong with them. There are really legitimate reasons why someone might not learn healthy relationship skills. There are things that prevent people from having healthy relationships. A common one is past trauma. And as an example, I met someone who was in her early 50s who had never had any kind of intimacy in her life whatsoever, had never held hands, never kissed anyone. And I believe this was largely as a result of sustained and repeated sexual abuse at the hands of her father. Now, I'm sure you can imagine when the person who's most supposed to keep you safe is the source of your abuse, how that would impact your sense of safety in the world. Another reason is various types of fear and anxiety. Fear of intimacy, fear of rejection, fear of abandonment, fear of pain, social anxiety, performance anxiety. All of these can be things that will, all of these will be things that could prevent us from being willing to take the risk to reach out and form those connections. Therefore, someone might get to a point in their life where they have a lack of experience, or they have less experience than someone in their situation would be expected to have. There are many different reasons for this. That might be debilitating shyness or social anxiety. It could also be disabilities. Now, with someone who has a disability, there are different layers to the impact that that can have on their life. First, the disability itself might prevent them from having access to some experiences. But beyond that, and what I found is a much larger impact, is that the way that the culture at large or other people respond to them also has a big impact. Our culture tends to desexualize those with disabilities. In fact, our culture tends to desexualize anyone who's not young, healthy, able-bodied, even slender. We get loads of cultural messages about what is attractive. As a result of these messages, it's natural for someone who doesn't fit the ideal, which is most of us, to feel shame, to start to believe that they're not worthy of pleasure and connection. So in general, for any reason someone would have a lack of experience, there are 3 layers of impact to that. There is the issue that prevents them from having the lack of experience in the first place, or the source of the inexperience. Then there's how other people and the culture at large respond to this issue. I'll call that stigma. And finally, there's whatever shame we might feel as being a part of a culture where we're not fully accepted for who we are. So in fact, any barrier to intimacy has these 3 layers of difficulty intrinsic within it. So now let's come back to other reasons why someone might have a lack of experience. Another is that someone might be presenting with a different gender or orientation, different than they've expressed in the past, and they are inexperienced with that way that they're presenting, and they might need a safe and supportive environment within which to explore and get to know themselves better. I had a client once who believed that if she were to be around other people, she had to be happy and joyful and really the life of the party. So if she ever couldn't be that way, then she would isolate. If she were ever sad or depressed, she would avoid other people. And her friends would literally notice that she would drop off the face of the earth for months at a time. And this is a big barrier to healthy relationships, and she wanted to learn to be more authentic and to be willing to share herself and what is genuinely going on rather than the image that she thought she should have. And finally, some people have such a critical self-image or body image that they've started to believe that they're not worthy of touch and connection and pleasure. So for someone who hasn't been able to form healthy relationships on their own, we create this thing called surrogate partner therapy. And it's for anyone who has difficulty with physical or emotional intimacy, who has some barrier to that. It could be socially, it could be sexually, it could be in the context of intimate relationship. And they haven't been able to resolve this difficulty either through their own life experiences or from verbal therapy alone. A typical client of surrogate partner therapy may have one or more of the following characteristics. And there may be overlap between these. They are certainly not discrete. And most of these are also things that prevent them from having healthy relationships. A typical client may have high amounts of trauma in their past. They may be dealing with fear and anxiety. They may have a lack of experience. They may not be willing to be authentic in their relationships. They may have a harshly critical self-image or body image, or they may have some level of sexual difficulty that they wish to address. In order to help a client like this, we want to create an environment that is both supportive and realistic. Now, if you look at ways that people sometimes address these issues, on the one hand, you've got dating or trying to do it through your own life experiences. This is very realistic, of course. However, it may not be supportive enough. In this situation, you've got other people, and they all have their own fears, their own needs, and their own issues. That other person you're engaging with may withdraw at any time for their own reasons that have nothing to do with you. And that person is not signing up to be supportive to allow the other person to resolve their issues. So it may not be supportive enough. On the other hand, we've got verbal therapy. Now, verbal therapy is very supportive. However, there's a big difference between talking about taking a risk and actually taking a risk. In verbal therapy, the client might be able to stay in the intellectual theoretical realm. The intention of surrogate partner therapy is to create an environment that combines the supportiveness of verbal therapy with the real life experiences and the realism of actually forming relationships and actually connecting with people. To do this, we create a collaboration of 3 people. First, there's the client. Then there's also a therapist or a clinician. And finally, there's a surrogate partner. There are 3 of us, and surrogate partner therapy is always done in this configuration, and it's called the triadic model. The therapist shown in this picture is Dr. Victoria King, who practices in Oakland, California. And the surrogate partner that is shown is myself. I identify as male, and I'm a surrogate partner who works with clients who identify either as non-binary or who identify as women, either cis or trans. But there are surrogate partners of various genders and orientations who are available to work with clients of various genders and orientations. In this process, the client is meeting with 2 professionals. Each of these professionals has different roles. The role of the therapist is to first evaluate the client, to determine whether they're an appropriate client for this type of work and whether they're likely to benefit from it. They will educate the client about what the process involves and to make sure they have realistic expectations. Once the surrogate partner is involved, the therapist will monitor the developing relationship between the surrogate partner and the client. The therapist will support the client. Sometimes clients sometimes clients have shame about the fact that they're getting this kind of help, so they may not be telling their friends and family that they're doing it, and so they may not have access to their typical support structures. And the support of the therapist and helping them understand the process is invaluable. Another role of the therapist is to help the client generalize. Generalizing is to apply the specific experiences and the specific things they're learning in the relationship with the surrogate partner to other relationships into their life outside of therapy. The therapist who's shown on the left is Dr. Heather Howard, who's a clinical sexologist who practices in San Francisco. In contrast with the role of the therapist, the role of the surrogate partner is very different. The surrogate partner will partner with the client and engage with them in direct, hands-on, experiential exercises that are designed to build awareness and skills in the areas of physical and emotional intimacy. The surrogate partner will form a temporary relationship with the client to give them that real life environment within which to try different things, to take risks, to see what works, and to build confidence and skills. In this relationship, the surrogate partner will also model healthy relationship skills, including authenticity and vulnerability. Here I've added a layer of shading that indicates the part of the process where the surrogate partner is active. And that makes it very clear that the therapist has responsibilities before, during, and after the surrogate partner is involved. The relationship between the surrogate partner and the client goes through different phases. It has an arc. It is a journey. And I call it the hero's journey because inherent in this journey is the opportunity for clients to face and address everything that's prevented them from having healthy relationships in the past. We start out with a three-way meeting. We then do some foundational work where we build awareness, boundaries, communication. We work with consent. We build safety and trust. We're going to be using gentle, nurturing touch. We'll be doing body image work. Along the way, we'll do some sex education until eventually we have a suitable foundation that allows whatever core issues need to be addressed to be addressed. And then eventually we move toward closure. It is a temporary relationship, and it's understood right from the beginning that it's going to end at some point. So now I'd like to take a look at each of these parts of the process in a little more detail, starting with a three-way meeting. The three-way meeting ideally happens at the beginning, where we all three meet together and establish that we will be working as a team, that there will be open communication between all of us. And we also want to get really clear about what the goals are. In the three-way meeting, we all meet together in the same room. After that, however, the client will meet separately with the therapist and then meet separately with the surrogate partner, alternating between the two, back and forth. Between every session, the surrogate partner and the therapist are communicating also. So there's open and honest communication between all three members of the triad. Early in the process, we want to establish certain foundational skills. The importance of this phase became very clear to me early in my practice. And I want to share with you an experience that was a game changer for me. I had a client come to see me, and in the course of our appointment, I asked her, incidentally, because I work with clients who identify as women, then I'm going to be using she, her pronouns to give the client examples. Some of the client examples may be modified either to protect confidentiality or for their educational purposes. In the course of our meeting, I asked the client if she would like to share a hug. She said yes, and we hugged, and I thought that everything was okay and continued for the rest of the session. Later, she canceled her next appointment. And I'm grateful to this day that she was willing to let me know what happened for her. Whenever I asked her if she wanted to share a hug, she didn't want to, and yet she didn't feel comfortable saying no. This made it very clear to me. So she did something she didn't want to do. I didn't pick up on it. And after that, she didn't feel safe. This made it very clear to me that there are certain things that need to be established right at the beginning. We need to establish that the client has the awareness to know what they want and what they don't want. Once they have that awareness, we need to be able to act on it. We need to be able to ask for what we want or move toward what we want and have boundaries against what we don't want. And the typical way that we do this is through communication. So the awareness boundaries and communication are an important part of the foundational process that must be established before we can move on into the more intimate areas of the work. Because these three words start with A, B, and C, I've started to call them the ABCs of SPT. There are many ways that we might establish the ABCs, and we have a bunch of different exercises. Different surrogate partners will use different exercises, but I would like to share with you a couple of my personal favorites. In order to establish the ABCs, we can do communication exercises, and we also employ mindfulness practices involving touch. My favorite communication exercise is a communication game called May I or May I Will You. It has that name because those are ways that we might start a direct request. It involves two people. One person will start out by making a request that begins with may I or will you. The other person will respond yes or no. And the person will say thank you, regardless of what the answer is, even if it's a no. Then we switch roles so that the other person makes a request, response, thank you. Switch roles again, alternating in the form of request, response, thank you, request, response, thank you. And I would like to invite Melissa to do a little demo with me. Melissa, will you massage my neck?
No.
Thank you.
May I call you?
No.
Thank you.
Will you come up to San Francisco right now and give me a hug?
No.
Thank you. Thank you, Melissa. So I like to do this exercise in 4 different phases. In phase 1, as you saw with Melissa and I, all responses are no. It's really valuable to have practice with not only saying no, but also hearing no in response to a request. That can be really, really hard for some people, and we want to make sure that this can be done with comfort. If it's difficult in a simple exercise, it's going to be even more difficult in a real life situation where people are vulnerable and maybe even where people are naked. So we want to establish this in a low risk environment by making simple requests. After phase 1 can be done with comfort, we might move on to phase 2, where all answers are yes. Sometimes it can be difficult for people to say or hear yes, and it's important to be comfortable with that also. Once we know that we can say both yes and no, we might move on to phase 3, where in response to a request, I will check in with myself and consider, do I genuinely want to do that thing? And then I would answer honestly. Now, in phase 3, it's just a communication exercise. So even if the answer is yes, we're not actually doing anything. Same with phase 2, by the way. That is left for phase 4, which is just like phase 3. However, now, if the answer is yes, then we will go ahead and fulfill the request. If the answer is no, then we're not going to do anything. Now you'll notice that each of these phases builds upon earlier phases to become more and more lifelike, more and more realistic. It might take me several weeks, if not months, to get to phase 4. I think that may I will you, and exercises like this are valuable for many reasons. The first is that we get a deeper awareness of what we want, and we practice asking for it. We also get to practice saying no and hearing no, and this is an important component of boundary setting. Now, sometimes people associate boundary setting with breaking the connection. They may have had past experiences where when they set a boundary, a relationship ended. Whereas in this, we want to get an experience that we can set a boundary without breaking the connection. Saying no or hearing no does not mean rejection. It's just information. And that information can actually be used to build the connection rather than end it. Have you ever heard this saying, no is a complete sentence? In this exercise, we get a chance to say no without feeling like we have to give a reason or to justify it. And this builds worthiness. I learned that I deserve to be able to want what I want and ask for what I want, even if someone else wants something different. This is an important component in conflict, in negotiation, and intimate communication. And it's also an important skill in navigating consent. Another tool that we use is touch. I will start out by having a client touch an object, because when you're touching an object, you're not worried about how the object is receiving your touch. You're not worried about the impact that your touch is having on the object. This gives you complete permission to be focused on your own experience, the sensations that you're getting through the process of touching this object, and if you're experiencing any pleasure from doing so. And we really want to establish a certain foundation of that awareness, that I do have a direct connection with my pleasure and my sensations, and I'm able to have my awareness on myself and my own experience. Once this has been established, we can actually take that self-awareness into our relationship with a partner. Whenever we're engaging with a partner, we don't want to be so focused on the experience of our partner that we lose touch with what's going on within us. Instead, we want to bring in our own awareness and an understanding of what's going on for us, even as we engage with someone else. Sometimes these touching exercises are referred to as sensate focus exercises. And there are many different benefits from incorporating touch in the work that we do. One is something that's called nervous system co-regulation. This is a way by which someone who's experiencing anxiety or otherwise has a dysregulated nervous system can get a direct hands-on experience of someone else who has a more regulated nervous system. This is incidentally the way that all children are when they're young. Children don't have the ability to self-regulate. Instead, they learn self-regulation through this process of having a caregiver, and they are able then to learn to co-regulate, which is the first step toward learning self-regulation. Now, this can be learned at any time throughout the life cycle, even as adults. There's a direct nervous system to nervous system communication which can really be beneficial. Touch also builds intimacy. We get to know each other, not just through conversation, but viscerally, somatically. Touch can be reassuring, nurturing, and bonding. Through touch, we get a deeper awareness of the ways that we like to be touched, maybe the ways that we don't like to be touched, our preferences, and the physical sensations. We start to tune into the feedback that we're getting from our body and the information that we're getting from it. Then we can learn to be more pleasure-oriented rather than performance-oriented. We can also start to develop a better vocabulary of sensation and of feeling, and this gives us the tools for better communication to be able to communicate our inner experience to a partner. Through this process, we gradually introduce more and more of the body to touch, to sight, and to the relationship. Oftentimes, people relate to their body by the way that it looks visually, especially as compared with idealized objects like movie stars and models. However, if you close your eyes and allow yourself to be touched, you might find that you can experience sensations and pleasure from that touch, regardless of your age, weight, body type, ability, gender, regardless of any of these things, and regardless of possibly those qualities in your partner. And when you start to see your body as a source of pleasure, rather than something that doesn't look the way others do, or rather than doesn't look the ideal, that is a profound shift in a change in body image. But in this process, we go far beyond that. So sensate focus is a valuable tool to work on body image. But we actually have exercise specifically devoted to body image work. In our intimate relationships, we become naked, physically and emotionally. And the way that I feel about my body and my relationship with it has a big impact on how open I am to sharing my body with others. Let's come back and take a look at the arc. So far, we've talked about the three-way meeting, the foundations, consent, safety, touch, and body image. And eventually, through all these processes over weeks and months, we have established a suitable foundation that would allow whatever core issues arise, or whatever core issues brought the client into therapy, to be addressed. Any aspect of relationship can be included, including social skills, including intimacy, including sexuality, including eroticism. But something is only included in the therapy under two conditions. The first condition is that it's necessary in order for the client to reach their goals. The second condition is that what we've done so far has established a suitable foundation that would allow that activity to be corrective. We absolutely don't want to be taking behaviors that aren't working and reinforcing them. Instead, we have to make sure that what we've done so far has created a suitable environment that things can be done to create change, that everything we do is healing and transformational. And Some of the conversation that we have between the three members of the team is about whether that is the case and what primary skills have to be developed before we move on to the next step. And is the client ready for the next step? And these decisions are made collaboratively between all three of us, the client, the surrogate partner, and the therapist. And sometimes the communication that we have about that is the most important part of the therapy. It is the potential for actual intimate contact that creates the real life environment that gives this modality its power. In verbal therapy, by contrast, certain aspects of relationships are off limits. Therefore, the client never has the opportunity to face fears and take risks in these areas. The client is able to remain in the intellectual, in the theoretical realm. Whereas, in contrast, surrogate partner therapy is specifically constructed to give the client opportunities for growth in touch, nudity, body image, physical and emotional intimacy, all while having the support of their therapist all through the process. With the involvement of these two professionals with distinct roles, we create the opportunity to do genuine work with intimacy, sexuality, and relationships while still maintaining checks and balances and client protections. It is a real relationship, and there are genuine feelings that might arise. And some people ask, well, what about attachment? What happens if the client falls in love with the surrogate? Or even vice versa? Well, remember that a client who needs this type of help has not been able to form the connections that they want to have in their life. So for someone to feel safe and open enough to be able to form an attachment can actually be a step in the right direction, and a very important one. But then people ask, well, it is a temporary relationship. That means that it's going to end. Might that then be painful for the client whenever that relationship ends? And always, whenever I'm presenting about this, I usually ask the people in the audience, how many of you have ever had a relationship end? And inevitably, almost everyone in the audience raises their hand. The end of a relationship is an inherent part of relationship. All relationships will end in one way or another. I like to think of surrogate partner therapy as giving clients an experience with every phase of the life cycle of relationship, including the ending. There may be, some clients are so afraid of what might happen at the end of a relationship that they won't even take the risk to begin the relationship in the first place. Now, when that relationship does end, there may be feelings, there may be grieving, there may be sadness. It is a genuine relationship, and genuine feelings will arrive. But it's important to know that these feelings can be survived. These feelings can be managed. And actually, we can develop a different relationship with these feelings rather than believing I shouldn't be having these feelings. I can get a sense that feelings are part of being human. Now, we want clients to be able to take the learning from a relationship and to recognize how they've grown and changed. And that makes them better people then to move into their future relationships with greater confidence. I think that in our culture, we're not very good at breakups. Either we tend to blame the other person and make them wrong, or we tend to blame ourselves and make ourselves wrong. In surrogate partner therapy, the intention is to have a genuine no-fault breakup. And I believe that if more people had the sort of breakup that we practice, then the world would be a better place. There are a number of places to get more information about this practice. One is there's a TV show on CNN called This Is Life with Lisa Ling. The season premiere of season 4, which aired in September of 2017, was called Sexual Healing. And it interviewed a surrogate partner, and it showed examples of the work, and it also interviewed 2 of her clients, one of whom had severe childhood abuse and trauma, and the other who has cerebral palsy and was affecting, it was a physical disability. A link for a place that you can view this episode is shown on the screen. Another way to learn more is through a series of courses that I've created and then I offer about once every 3 months. They are for anyone who wants to do a really deep dive into this process and how it works, but it's specifically oriented towards those who wish to practice it, collaborating clinicians and therapists, as well as surrogate partners themselves. The first course is called Collaborating with Surrogate Partners in the Triadic Model. And the second is called How to Help Clients Generalize Surrogate Partner Therapy. I believe that this process of helping someone apply these experiences to their future relationships is really the essence of the work. And in this class, we really look at what can be done to support this process and what gets in the way and others. The next Collaborating with Surrogate Partners course is offered a week from tomorrow on March 27th. And for those watching in YouTube land, the best way to find out upcoming course dates is to go to the website of the Surrogate Partner Collective, surrogatepartnercollective.org, and click on courses. The Surrogate Partner Collective is a good source of information as well, as is the website of the International Professional Surrogates Association, which is surrogatetherapy.org. And I promised that I would leave plenty of time for questions. So at this point, I'm going to stop the screen share and come to your questions. Someone asked, how much does it cost? As you might imagine, having ongoing therapy involving 2 professionals may end up being quite expensive. There we go. And this is one of the drawbacks of the therapy. I have had clients who literally paid me thousands of dollars over the course of this work. And then they're also paying for the therapist as well. So it can be quite expensive. However, there are surrogate partners that do offer a sliding scale. One of the drawbacks about surrogate partner therapy is it's not very well known. And I'm committed to changing that, but there aren't a lot of places throughout the world where surrogate partner therapy is practiced. Here in the United States, there are a distribution of surrogates around the country. There's also a clinic in Israel where the practice happens. And there's also one in the UK. I understand the work's been done in the Netherlands, but I am not familiar with any place that, with any practitioners in Denmark, which was one of my next questions. Someone asked, in phase 2, are there boundaries as to what can be asked? That's a great question. No, there are no boundaries as to what can be asked. In fact, this is actually a valuable part of the process because we Sometimes whenever we're making requests, we only will make requests if we think the answer is going to be a yes. Now you can imagine that that's limiting. I tell my clients, if you're not getting an authentic no from me, then you're not asking for enough. So clients can really ask anything. It can be related to touch or sexuality. It can be even outlandish things like, will you buy me a car, or will you take me on a vacation? So we really want to stretch the capacity to ask for things as a way of building comfort with his skills. Someone asked, does the surrogate ever have sexual intercourse with the client? That is a possibility. As I said, any aspect of relationship can be included, including sexuality. Even, and it can be included under those two conditions. The first is that it's necessary to be done in order to reach the goals. And the second is that what we've done so far has made it possible that that can be done in a healing and transformative way. Now, I would then ask you, so what would have to happen for sexual contact to be healing, beneficial, and transformative? And that is the sort of discussion that we have all throughout this process. Sometimes people ask about how surrogate partners are trained. Reputable training programs typically have two components to them. First, there's extensive coursework that allows the trainee both to learn about the theory and the didactic information about the practice, but they are also able to be partnered with other trainees to be able to do the sorts of exercises that they're going to be doing in relationship with clients. Now, if the class is completed successfully, then they may be approved to move on to a supervised apprenticeship. In the apprenticeship, they would be seeing clients under the supervision of a more experienced surrogate partner who mentors them. It took me more than 2 years to complete my apprenticeship, and now I'm at the stage of my career where I'm mentoring others who are in that phase of their training. Organizations that train surrogate partners include the International Professional Surrogates Association, IPSA, the Institute of Mind-Body Therapy, and the Surrogate Partner Collective. We at the Surrogate Partner Collective are intentionally creating an organization that is run collaboratively and deliberately seeks out diverse voices and experiences. So someone has asked, are there requirements on who can become a surrogate partner? Well, there is a rigorous application process to become a surrogate partner. It's basically, people need to be really comfortable with their body, their intimate skills, their sexuality, and they need to be able to be accepting of a full range of human emotions, both in themselves and in others. Because if I'm ever not comfortable with my own feelings or my own experiences, then it will be more difficult to show up with a client. I think that what helps me to be able to do this work is because I'm willing to be vulnerable. I'm willing to share my experiences. Like one person asked in an interview, you must be the most sexually confident person ever. And I would answer that question by saying, no, I'm not, but I don't have to be, right? It's not my job to be a sexual stud or to be, or to be able to be so empathetic that I can read someone's mind, because this isn't helping them prepare for future relationships, right? Their future relationships are going to also have their fears, needs, and issues. So rather than being a stud, it's more important for me to acknowledge that I'm not a stud and to be able to talk about my insecurity, my discomfort. As an example, I can even talk about this presentation. You know, I don't know whether or not I'm giving a good presentation, but I can share about my experience of doing it. And my experience is that I'm nervous and I'm putting a lot of pressure on myself because I know that this is going to go on YouTube. And I also, a couple of days ago, I had a sty in my eye, and I was hoping it would be gone by now, but it's not. So here I am. I'm not looking my best, but I'm able to share about my experiences. And it's the same thing that I do in surrogate partner therapy, right? I don't have to be perfect. In fact, it's more valuable for me to be honest and vulnerable about my experience of not being perfect, because that's what clients can relate to. Someone asked, does a surrogate ever work with a client who is in a relationship outside of therapy and outside surrogacy? If a client has their own partner, if they're already in a relationship, the recommendation is for them to work on that issue with their partner, right? I wouldn't recommend surrogate partner therapy in that context. Instead, I think of surrogate partner therapy as ideal whenever a client has some issue related to relationship, but the issue prevents them from finding a supportive partner. The issue prevents them from being in a relationship that they could use to resolve it. So it becomes a catch-22. I can't resolve the issue without a relationship, and yet the issue prevents the relationship. So what we do is we create a relationship for therapeutic purposes. Someone asked for how long a time period does a surrogate partner therapy program normally run? It can vary. I'd say on average, maybe 15 to 30 appointments. But I have had times where I would spend more than 100 sessions with a client over a period of almost 2 years. So it really varies based on what's necessary and what is agreed upon by all of us about how long it should take. It based on someone's past experiences and someone's past experiences and the issues they want to overcome, we might move more slowly in some situations than others. And with one client, I might do in 12 sessions what I might do in 2 sessions with a different client. So the pacing is customized specifically for each individual client. Someone asked, how did I start to become a surrogate partner? It probably started way back about 21 years ago when I started dating someone who had been the victim of sexual assault a couple months before we had met. And in this process, there was the attraction between us. However, there was also, I could sense a lot of fear in her. And because of course she didn't want to repeat this experience that she had just had recently. That was quite traumatizing. And so I realized that if I would come on to her too strong, if I would come on to her with agenda, that she would withdraw and and that neither of us would then get our needs met. And so I realized that it was all about matching her pace and her speed and being with her in whatever pacing was necessary. And that's the way that we were going to be able to connect. And this is the same sort of approach that I bring to my work as well. Someone asked, how do you find a surrogate? Well, there are a number of places to get referrals, both to surrogate partners and collaborating clinicians, because they are both required as part of this process. One is by contacting the Surrogate Partner Collective at surrogatepartnercollective.org. And the other is IPSA, the International Professional Surrogates Association, also has a referrals coordinator. Well, thank you very much for having me. It's been a pleasure. And you can reach my website at surrogatepartner.us.